Welcome, everyone. Thank you all so much for joining us. I'm delighted to introduce all of you to our presenter for today, Dr. John Caffaro. Dr. Caffaro serves as a distinguished professor at the California School of Professional Psychology and Alliant International University. He's also a clinical assistant professor at UC San Diego's School of Medicine. He is also an internationally recognized expert on sibling violence and sexual abuse. He's trained mental health professionals nationally and internationally for over 25 years. His most recent book, Sibling Abuse Trauma, the second edition, was published in 2014. And he was recently honored to receive the APA Award for Distinguished Contribution to Family Psychology. We are so honored to have you here, Dr. Caffaro, and I'm going to turn it over to you to get started.
Thank you, Jackie, and welcome everyone. Thank you very much for joining me today, and I'm honored to have so much interest in this topic. I can tell you that it wasn't always the case. This has been kind of a thing that I had no idea from the beginning that it would become sort of a major thread throughout my career, but turns out that that's the way it's been, and all for the better, and I hope that I can share with you some of the research and clinical knowledge that I've gained over the last 25 years or so in this specific area of child maltreatment. So let me cover the learning objectives for the presentation today. We're going to hopefully be able to at least allow you to be able to describe at least 3 criteria for distinguishing between sibling rivalry and sibling violence. Also going to be able to ask you to identify evidence-based risk and protective factors for families where sibling sexual abuse has occurred. And finally, offer you to describe 2 trauma-informed intervention strategies for addressing sibling violence and sexual abuse. We thought that it would be interesting and maybe useful to get a sense of how much interest and expertise there is in this room today about sibling relationships and sibling abuse in general. So if you might just want to drop into the chat at some point how much of your professional education and training was focused on sibling relationships as you were getting your own training. And then secondly, how much clinical experience do you actually have working with sibling abuse trauma? I suspect that there's a wide variance and variety of answers to that question in the room today, and be interested in hearing about that. And if I get that information while we're together, I'll try and tailor some of my presentation to various levels of expertise.
John, we're seeing in the chat that people really did not get a lot of training on this in their clinical training. Seems like very little, no formal, none, very little, but then also folks are saying that they have seen some of it in their work, despite the fact that folks had not. And someone's saying, Tori's saying, almost no information, but have seen it more often than I expected.
Yeah. And that's pretty consistent with my experience as well. And I think with the experience of the field. One of the main things I'll talk about this near the end of the presentation today is that there's an initiative that I've become a part of out of the University of New Hampshire Crimes Against Children Center that is designed to just really increase public awareness and advocacy for this area of child maltreatment. So you should be hearing a lot more about this over the next several years, thanks to a generous foundation grant that was received around this issue. But I can tell you that it's traditionally been one that's not addressed at all, even in graduate programs in social work and psychology. And so hopefully I can enlighten you a bit about some of the things that we know and some of the things that we don't know going forward. So let's talk about the context of siblinghood, just to provide a general overview of sort of the context in which we'll be drilling down today. Despite declines in family size in the West, probably many of you know that the birth rates have been declining in the United States for a while now, and actually not only in the United States, but throughout the West, there have been declines in family size, but still about 80% of the world's children live in a home with at least one sibling. So what I'm about to talk about today has the potential to affect many of us in many homes. And in fact, siblings constitute our closest genetic and often longest lasting interpersonal relationship. Our sibling relationships outlast our relationships with our parents by about a generation, about 20 to 30 years. And in fact, it may be an interesting thing to just contemplate, but it's much more likely that on your deathbed, the person next to you will be a brother and sister than a spouse. That just gives you a hint of how important the sibling relationship is to most of us. And sibling interdependence begins very early. For instance, by the age of 5, second-borns actually spend a lot more time talking and playing with an older sibling than parents. And in the majority of cultures, which I'll spend a few minutes talking about later, siblings are actually often used as principal caretakers and companions of young children. So there's a lot of important roles that siblings have in the family that obviously provide protection and strength and lots of opportunities for learning for children growing up. But also, as you see when we get into the main event of today's presentation, can also be problematic in some ways. So if siblings also share this intense family history, given what I've just shared about how important that interdependence is, what we're going to be really talking about today and swimming around in for an hour and a half is, what if that history has been marked by violence and or sexual abuse? So in order to sort of begin to answer that, we have to talk about the significance of sibling attachments. Understanding the context of siblinghood is important because it's a useful entry point for inducing positive change in children's behavior. There's pretty good research evidence we have now that if intervention happens when there's problems between young siblings, it can actually make a big difference in the child's personality and behavior going forward, because it's a very useful entry point for making positive change and interventions, which is why I'm partly talking about this kind of stuff to people, because I think it's important to realize that the interventions can actually have an impact on people as they enter adolescence and even adulthood. The research suggests, for example, that children as young as 4 can act as sources of attachment security for infants. And that's both a protective factor for children, but also a risk factor for sibling abuse, of course. And there's a lot of cross-cultural evidence that suggests that a child's perception of sibling warmth is a powerful predictor of self-esteem. Now that's important because I don't know about you guys, but when I was getting trained in graduate school and in my doctoral work, we were pretty much focused on self-esteem, largely coming from parent-child relationships and the child's relationship with their caregivers. But actually, there's a fair amount of evidence developing that your perception of sibling warmth is also a very important source and predictor of self-esteem going forward. And finally, sibling attachments also seem to be very important in shaping an individual's ability to navigate other close relationships. There's this phenomenon in developmental psychology called the carryover effect. And the carryover effect basically is demonstrated that the kind of relationships we have with our brothers and sisters growing up has a pretty important effect on the sort of best friend relationships we have, even as children, and even some people would contend the important intimate relationships we have in our lives with colleagues and even spouses as adults. So the attachment has important generalizability. Just to make this clear to you, and I'm going to make a couple of comments here about this business with relation to men in particular, because in my experience, we don't talk about this kind of stuff with regard to males nearly as often as we ought to. But there was a longitudinal study that looked at Harvard graduates, basically, over the course of about 30 years, over the course of their lives after graduation. George Vaillant was a Harvard graduate and a developmental psychologist himself, and he was the one who did this study. And he tracked Harvard graduates' behavior over the course of their lifetime after graduation and found that closeness to siblings was the single most significant predictor of later life adjustment for men. I want to make this point because it's so profound to me, and it's something that so many people overlook, I think, when thinking about how importantly sibling relationships are related to psychological and physical health as we age. The single best predictor of emotional health for men at 65 age or over was having a close relationship with a sister. This was more predictive than childhood closeness to parents, more predictive than emotional problems in childhood or parental divorce, even more predictive than having a successful marriage or career. Now think about that for a moment. I don't know about if there are any of you in the audience who are in the teaching role or faculty role as I am, But in my experience over the last 20, 25 years or so, when I look at my graduate students over the course of the semester, most of the people in my class are women. In fact, about 85% of psychology graduate students right now are female. So there are usually only a handful of male in the class. And when I talk about this data to men in the class, I look at them and I say, look, if you have a messed up relationship with your sister, now is the time to start repairing it. Because as you get older, this is actually going to have an important impact on your emotional and physical well-being. There is also evidence to suggest that men who had poor sibling relationships during childhood are at significantly greater risk for depression in adulthood. So it works both ways. A good relationship with a sister for men getting older is actually a very protective factor, and a poor relationship for men with their brothers and sisters during childhood is actually a risk factor for depression. So the perspective that I'm starting to unwind here is one that I call integrative and developmental, because I'm pulling from information from both developmental psychology, but also from an integrative theoretical point of view that I've used, a systemic, but also an attachment focused view. So the first important developmental thing to remind everyone about is that siblings have separate relationships that change when others intrude. There's really no established tradition in child or even family therapy. I was trained as a family therapist 25, 35 years ago. And for the most part, we think about family therapy as either having all members of the family in the room or having parents and children. But there's pretty good evidence to suggest that we ought to also be focusing more on interviewing sibling dyads when we're working with areas, certainly with abuse trauma has occurred or suspected. Most studies of sibling abuse rely on parental rapport. And the reason why that is important is because of the notion I just mentioned, that if siblings have separate relationships that change when others intrude, this means that there's a very large risk of underreporting the incidence of sibling physical and sexual violence, because the nature of the sibling dyad is such that it's very sensitive to outside intrusion. In other words, this is just a long way of saying siblings often have different rules for engagement with each other in the presence of parents and outside of the presence of parents. So siblings may not know, parents, may not know about sibling abuse going on right under their own roof. Each child inhabits a kind of niche within the sibling, what I'll call microenvironments, these sibling dyads that are actually in very much important ways insulated from the rest of the family at different points in the child's development. And formative aspects of development occur in these sibling niches. There are ways to sort of almost accelerate our development. We learn things like how to share, how to compromise, how to resolve conflict successfully, usually first with our sibling if we have a brother and sister. But that also means that two children growing up in the same home might have very different experiences of growing up in that family. And the reason for that is pretty straightforward, because often parents might treat them differently. When I've done workshops for parents like this before, for example, I'll often ask parents in the audience, how many of you would say that you love your children equally? And almost everyone raises their hand. But the data actually contradict that view. The data suggests that 2/3 of mothers actually acknowledge feeling more affection for one child over another. And guess which child is often noted as the one that mothers feel more affection for than another? How many of you in this room are the youngest? It's us, the babies. So if you're youngest, you might have gotten some special attention or affection as a child growing up. And that could be a source, an important source of why you and your brothers and sisters might have different experiences of growing up in the family that really don't coincide on many levels. But also remember, siblings can also interact equally with each other. So there are two ways in which it might help explain why siblings growing up in the same home might have very different experiences of that family. Now, remember, when I say this, I don't mean to generalize it to every home, but in fact, all things being equal, youngest often get preferential treatment. Another element of this integrative developmental lens that I want to share before we get into the details of abuse in particular is that the attachment relationship is very important. And attachment theory basically posits that family relationships, including sibling relationships, guide the ways that we interact with others through what's called an internal working model. Some of you that know attachment theory may have heard of this. It's basically that internal interpersonal lens that we use to sort of direct our view of the world, and specifically direct our view of other close relationships. And multiple studies have documented associations between sibling relationship qualities and peer functioning, for example. So this internal working model, if you will, that we usually form in our sibling relationship also serves as a template for how we develop peer relationships. And these studies have been done cross-culturally among European, American, and Chinese families, all with the same results about how important attachment in the sibling relationship is for forming other peer relationships as we age. So the thing here that I want to point out is that siblings can become, in some families, what I'll call emotional stand-ins for unavailable caregivers, and thus powerful sources of attachment figures. Again, traditionally in developmental psychology, we think about parents as being the primary attachment figures for children. And in fact, in many homes, that's the case. But in some homes, we'll talk about this a bit more in detail in a minute, siblings become very powerful source attachment figures for younger siblings. I'm sure many of you have worked with families where an older sibling is acting as a parent figure for a younger child or children. In those cases, the attachment bond between the older sibling and the younger sibling may be just as important an attachment source of security as a parent figure might be. And these inner representations of that sibling also can serve as templates for future close relationships for that child. So this suggests, again, that we need to broaden our notion of who the child's carers are beyond parents to include siblings. So what do we know about the sibling domain? What do most of us hear when we think about the sibling domain? Well, the first word that comes to most people's mind when we talk about siblings, at least in our field, in the psychology or clinical field, is rivalry. Sibling rivalry and fighting are usually considered almost a normal part of family life. In fact, the word sibling and rivalry sometimes look synonymous in terms of our society's view. And pundits throughout history have enjoyed thrashing siblings. George Bernard Shaw famously said, as a rule, there's only one person an English girl hates more than her mother, and that's her eldest sister. And lest we forget, one of the founders of psychoanalysis and psychology and psychotherapy, Sigmund Freud himself, looked at the sibling relationship as basically what he called a domestic boxing ring. He thought that the function of the sibling relationship was primarily for children to fight out over the love of mother. But rivalry alone is not enough to explain abuse. And in fact, that's a fairly Western biased view of the sibling relationship. The preponderance of Western-bred research around siblings and sibling relationships makes the primacy of sibling rivalry appear normal and universal. In other words, most of the clinical and empirical research we have on sibling relationships comes out of the West. And because of that, it skews our perceptions of how sibling relationships often go. But 70% of the world that we live in societies with collectivist values. And many of those societies teach children to value a sibling's welfare as equal to, or even more important than their own. So for example, in West Africa, the Ashanti tribe has a saying, your brother or sister, you can deny them nothing. In Vietnam, terms to address lovers and spouses are an, which means big brother, and em, which means little sister. In Chinese families, there's a saying, the eldest sister acts as a half mother. So culture has a very important impact on the sibling domain as well. And the fact that there's more affluence, you might say, in Western cultures also presents what I think is a liability. It permits siblings to be more independent of each other. However, that freedom can also present a hazard. It also is far more challenging, in my experience, to develop and maintain strong sibling bonds in the Western, more affluent cultures, because fundamentally, we're taught especially in the United States, I think, that as soon as we reach the age of majority, as soon as we're old enough to sort of make our own decisions and begin to launch from our families, the sibling relationship is often thought of as one that's voluntary. Not the case in many of the other cultures in the world. So we have to ask ourselves, where's the line between play fighting and violence? Very important question. And it sort of is the question that prompted the publication of my first book. The book Sibling Abuse Drama, that was first published in 1998, was the only book for mental health professionals published at the time. In fact, I think there were about 6 peer-reviewed articles in 1998 when my first book was published that even addressed sibling abuse. It was really pretty much an open field that almost no one was exploring. Thankfully, that has changed a lot. When the second edition of my book was published in 2014, I could say it was published in a very, very different psychological environment than previously. And there are a couple of things about the book that I just want to highlight. We'll go over a number of them in the course of this presentation. The book, the impetus for the book was a small research project that myself and my wife at the time developed and completed, which included data from 73 adult survivors of sibling physical violence or sexual abuse. We took a look at 73 adult survivors and really tried to get as important a qualitative view as possible as we could on how being abused by a brother and sister or brother or sister was different than being abused by a parent or other adult. And the other thing that we tried to develop in that first edition and that we've revised and revised again and again over the course of the second edition is to provide widely accepted definitions for sibling violence and sexual abuse. This is very important because without consensual or definitions that are consistent across the board, it's very difficult to track things like the incidence of sibling abuse. How often does it occur? And when do we know it's happening and when do we know that it's not? So the definitional criteria are important. We also developed a psychosocial assessment measure in the book called the Sibling Abuse Interview, which I provided the organization with today that you should have a copy of. And the Sibling Abuse Interview, or the SAI, is designed to basically evaluate systemic factors related to sibling abuse in different subsystems within the family, both in the sibling dyad, but also in the family as a whole. We'll go over it very briefly, but of course we don't have time to go over it in detail today, but it will be posted for you. And if you have questions about it, of course, I'm happy to answer. The other thing that the book provided is family characteristics that increased risk factors or vulnerability to sibling violence or sexual abuse activity. Again, something that wasn't present in the literature before this. And finally, we also provided multiple case studies with lots of concrete illustrations and extended therapy transcripts in order to demonstrate what we're calling as our therapeutic principles in action. So there are a lot of therapy transcripts in the book with children, families, and adult survivors who have experienced sibling violence or sibling sexual abuse, so that we can demonstrate also our approach for how to work with these cases in as clear a way as possible. So the first thing we have to do as we move towards developing a definition for sibling violence, when I say sibling violence, I'm talking about sibling physical and emotional abuse, is to distinguish it from sibling rivalry. Sibling rivalry is a factor in some families, and it's fairly normal, and it's mostly harmless part of growing up. Any of us who have siblings probably know something about that competitive rivalrous kind of connection we sometimes have had with a brother and sister. Any sibling interaction that leads to healthy competition without anyone getting hurt can usually safely be ignored. In fact, it's part of growing up with a brother and sister, and there's pretty good evidence to suggest that it's actually very helpful for many children growing up because it leads to a kind of healthy competition. And we also learn something about how to share, how to compromise, how to win without humiliating another person, how to lose without debasement. Those sorts of learnings turn out to be very useful for us as adults. So having this kind of opportunity to learn in our sibling dyad growing up turns out to be a very normal, healthy part of what gets learned in the sibling dyad, if the rivalry is relatively, functional, let's say. So then how do we distinguish that from what I'm calling sibling violence? Well, here's the criteria that we developed first in 1998 and that we refined over the last 20 years. Sibling violence consists of repeated instances of physical aggression with resultant harm. It also consists of an escalating pattern of physical or emotional aggression that parents seem unwilling or unable to stop. Bear in mind that most cases of physical aggression began with emotional aggression. So it's very hard to parse these out. We can talk about them in different ways just for the purposes of, learning. But in reality, any of us who work with families where there's been child maltreatment or even sibling abuse know that often these two kinds of sibling violence go together, physical and emotional aggression. The third criterion that we thought is really important and that we've tried hard to establish as a universal criteria for sibling violence is this concept of role rigidity that results in the solidification of a child who is harmed and a child who harms. And those roles seem consistent. In other words, you don't see a mutuality about the violence as much as one child mostly harming another. But what do we know about the incidence of sibling violence? Well, the results of a national study that was done about 10 years ago reported that almost a third of more than 3,600 children questioned said they had been the victim of sibling violence within the last year. More than a third, almost a third, I'm sorry. Children aged 2 to 9 who were repeatedly attacked were twice as likely as others their age to show severe symptoms of trauma, anxiety, and depression. These symptoms included sleeplessness, fear of the dark, and even suicidal ideation in some cases. And the range of acts of sibling violence included things like stealing a sibling's property, psychological abuse, and physical assault, either mild or severe. Now, just to give you some comparison for that incident number of almost a third of those children, in comparison, the research suggests that up to a quarter of children are victims of schoolyard aggression, or what we normally call bullying, a year. Yet I would contend that bullying gets a lot more attention than sibling violence does in our society and in our literature even. If we talk about incidents, we also have to talk about impact. The violence is believed to peak as the oldest sibling in the dyad reaches the ages of 10 to 14, early adolescence typically. And experts generally agree that the most violent members of the American family are its children. We just don't pay enough attention to that in the media. But it may also be the most potent sphere where family violence occurs. Sibling violence, particularly for the child in the offender role, for the child who is doing the harm, may be actually more predictive of later violence for that child than parent-child violence. For example, there's been several studies now that support the relationship between sibling violence and subsequent aggression. For example, dating violence. There have been a number of studies that suggest that for the child in the offender role, there's a relationship between hurting another sibling in childhood and dating violence in young adulthood for that child. There's also been data collected around sibling violence in childhood and elder abuse. So that even as we get older, it's not unusual for that internal working model, that template of power and control and harming a child often carries over into elder abuse. These relationships have been fairly firmly established in the literature, yet I would suggest to you that they don't get nearly as much attention as incidents of parent-child violence and abuse. So while peer aggression is generally considered as being more serious than sibling aggression, the results from the Tucker study that I just cited report that sibling aggression can inflict psychological wounds that are at least as damaging as the anguish caused by bullies at school. In fact, the scores for these children were higher who were subject to sibling aggression on measures like anxiety, depression, and anger for the children abused by siblings rather than the children bullied in school. So that means that we need to thoroughly understand the impact of it happening within our homes. And if you just think about it for a moment, I think there's some logical reason why this might make sense. You're not only let down by the person harming you, your brother and sister, but also by the carers who are letting it go unchecked. And what are those traumatic effects? I mean, if everything I'm saying is important, then the question becomes, why isn't there more attention paid to this kind of violence in our society and in our world? And I want to offer you some ideas about what I think about why that's true, and also some critique of those ideas. So the first is, there's a presumption, generally speaking, in our society that a child who harms cannot be all that strong. Victims, therefore, aren't going to be that damaged by threats coming from an age-mate young child. And there's also a presumption that child-on-child violence is developmentally normal. How many times have you heard parents where there's children being aggressive towards each other in the home saying, well, I did that when I was a kid with my brothers and sisters also. Isn't that normal? So child-on-child violence typically gets normalized, therefore harm and the harmed child somehow gets less stigmatized and violated. The belief is that that means that children won't be as affected by it. And there's also the presumption that children are developmentally more resilient when the one who harms them is a child. And finally, and very importantly, there's the presumption of mutuality and mutual responsibility. In fact, our language even supports this kind of presumption. We talk about sibling conflict and sibling aggression in terms of words like scuffles or fights or squabbles. They're often used to describe sibling violence. In the state where I am, which is California, part of the legal operational definition of child abuse includes what's called a mutual affray between children. How's that for euphemism? So I want to offer you some critiques of these presumptions as food for thought. First of all, the lack of socialization for young children often make children who harm more rather than less dangerous. Children may not mean it, but children can actually be quite violent because they're not socialized and they don't necessarily always make the connection between impact and harm on the child they may be harming. So the under-socialization of children may actually make them more rather than less dangerous. Remember, if we're thinking about this in the context of sexual harm, the data generally support the idea that the more it's more injurious, the earlier it's experienced. So why wouldn't we make that same generalization when we're talking about sibling violence, aggression, either emotional or physical? Another critique is that in actuality, when we talk about any kind of child maltreatment, two of the things that we always hear about in the literature are access and opportunity as being important factors to take into account when we've noticed the incidence of harm. Children may have much more intense and ongoing contact with sibling assailants than would most adult victims. Remember, many of the cases that I've treated over the course of my career have to do with somebody who's sharing the same room with the victim who's actually harming them. There's tremendous access when we're talking about the sibling relationship, much more so than you might have with parents. So I'm going to talk about the sibling violence piece in regard to several subsystems within the family, just to give you a more in-depth understanding of the impact in the family. I'm going to start with gender and boys. Boys are less likely to report being victims of sibling violence. This is important because it means that male victims tend to be overlooked. In fact, male victims of all kinds of interpersonal trauma tend to be overlooked in our society. And it's an issue that I feel importantly about it. And I think our field has started to take more importantly lately. But for a long time, almost all of the child abuse literature was focused on female victims. We're not there anymore, thank goodness. But boys are still less likely to report being victims of sibling violence, and therefore they tend to be overlooked. Boys are more likely to both use and suffer more violence and physical force in the sibling relationship. So it's a very important element of the family system to be paying attention to. And we think the fact that boys are more likely to both use sibling aggression and violence as offenders, but also suffer more violence as victims in the sibling dyad means that there must be something societal and cultural that we're teaching our boys about being tough, about masculinity that needs to be addressed here. And these messages, by the way, are pretty much across cultural groups. It's not just emblematic of our society here in this country. It seems to be universal, that there's a notion of masculinity that oftentimes becomes very problematic when we're trying to unpack why it is that males feel so entitled to be able to enact harm on either their brothers or sisters. But we can't neglect talking about girls, because the gender relationship in sibling relationships is important, whether we're talking about males or females. The lack of attention directed towards girls who perpetrate sibling violence may be linked to another stereotype that we have, that boys are aggressive and girls are not. And this is just not accurate. It just needs to be sort of refined in terms of what we mean by aggression. But there is the mistaken belief in our society that girls are not strong strong enough to do serious damage. In fact, Murray Strauss, a person who was who brought the idea of domestic violence and interpersonal family violence on the map about 30, 40 years ago. He's a very prominent family trauma researcher. He did a study many, many years ago around this issue of, are girls or boys more violent in the sibling relationship? And he confirmed in 1980 that, in fact, boys are more severely violent than their siblings than girls are. But the numbers were not nearly as great as the stereotype would suggest. It was 59% versus 46%. He made that observation back in 1980. The differences are not nearly as great as the stereotypes would suggest. And yet we're still saddled with that stereotype in some ways. And one more thing about this before we leave this point here, there's a construct that's emerged over the last 20, 25 years or so called relational aggression. Some of you may be familiar with it. It's a construct that's particularly used in relation to girls. And it has to do with the manipulation of the relationship to increase control, social status, include things like social exclusion, name calling, cliques, gossip, harassment, malicious rumors. Fundamentally, I'll call it the mean girls phenomenon, the attention that's been paid to the fact that girls can be also quite emotionally aggressive with other girls, but we don't necessarily look at that in the sibling relationship as sibling violence. So if we included the area of relational aggression in how often girls are actually violent in the sibling dynamic or dyad, I think those numbers would go up quite a bit. The other aspect of the sibling relationship and dynamic that we need to talk about are fathers and their relationship with sibling violence. Fathers' role may be particularly salient in terms of forecasting the quality of sibling relationships. We have a fair amount of literature about this, and it's very interesting, I think. First of all, father-to-child violence is thought to be a significant predictor of sibling violence. So if you're working with a family where father has been physically or emotionally abusive towards his children, male children in particular tend to identify with that role model, and male children report higher levels of sibling violence because they more closely identify with and imitate father's behavior. So there's a certain common sense to that. I think most of us would agree. If there's a father who's been abusive, with regard, for example, in the bullying literature, many times when people find a child who's been bullying, the first thing they may think about is, who's bullying that child? And often, unfortunately, it could be father in the family. But there's also another important aspect of this that I want to make clear, because I think it's something that gets under-addressed in our field in general. And that is that lower levels of paternal acceptance and family involvement are associated with negative effects on children in general, but especially on the sibling relationship. It's associated with higher levels of sibling violence. We have found across the board that peripheral fathers are overrepresented in families where there's sibling physical and emotional violence. And there's a reason for this. It's because father being able to be close with male children is a very important barometer of how those children develop empathy. And as we know, empathy development can serve as a protective factor, right? If a child is able to feel empathy for their brother and sister, they're less likely to harm them. But if we understand that some of that empathy development comes from a close relationship with the father, and the father is absent, that's going to make it more challenging for that same child to develop that kind of empathic relationship with their brother and sister. So that leads us to the other element of the family system, the couple. Couples and sibling violence is also important because we all know the intergenerational transmission of violence in many families flows from adults to children. We've known this for a long time, that if there's conflict, aggression, violence in the parental relationship, it's likely to trickle down to the children and the sibling relationship. In fact, there's a very, very strong, about 50% co-occurrence between what we would call domestic violence and sibling violence. So in my practice, if ever I'm treating a case where there might be documentation of domestic violence, of spousal violence between one partner and another, I'm always going to assess for any violence in the sibling relationship, because the co-occurrence of these two kinds of violence in the same family is fairly high. So a violent sibling relationship can often be a mirror for a high conflict sibling relationship. And children exposed to parental violence learn to model that assaultive behavior, unfortunately. We think what's happening in this case is that they're learning how to act aggressively about the conditions under which aggression can be applied in intimate relationships. In other words, there are kind of rules that get communicated to children, both consciously and unconsciously, about what's okay, what's permitted in terms of how one might resolve a conflict or how might control. So it's very important that we realize that those rules, if they're taught from modeling by parents, they're going to be very much likely to be also generalized to the siblings in that same family. Now, there are two important things about this kind of intergenerational transmission of violence that I think are important. Byproducts of growing up with interparental violence include two things. One, accepting violence as a way to resolve conflict, which of course is problematic on many levels. But two, devaluing females, because we know that still, even today, the majority of spousal offenders are men, which means that the predominant number of victims are women. So unfortunately, one of the rules that gets communicated if siblings are seeing this modeled in the family has to do with also their values about women and females. Okay, so I've separated the presentation about 50% into sibling violence and sibling sexual abuse. And I'm going to transition into the sibling sexual abuse area. We'll talk about some ways in which sibling sexual abuse differs and is a phenomenon of its own that needs to be treated differently, but also some ways in which it's also has in common elements of the things I've talked about previously with sibling violence and sibling aggression. Again, to set some context for this, our national awareness in response to child sexual abuse in general has changed dramatically over the past 2 decades. Child sexual abuse, meaning for the most part parent-child sexual abuse, has declined in our society up to 30%, according to a number of comprehensive national studies over the last 15, 20 years. This is something that a lot of people aren't aware of, because if we're working in the trenches with child sexual abuse, we may not as clinicians necessarily see declines in our experience. But in fact, the research behind this decline has been documented now across the country, not in one state, and across substantiation rates, not just talking about reporting rates, but actually declines in incidence. However, for the most part, when we talk about these declines, we're talking about parent-child sexual abuse. Sibling sexual abuse, another matter. What receives considerably less attention is the fact that more than 1/3 of the sexual abuse of America's children is committed by other minors. And a significant number of those who sexually harm are siblings, in particular brothers, who reside in the same household. So the United States Department of Health and Human Services reports that about 0.12% of children are sexually abused by an adult family member each year. By comparison, at least 2.3% are sexually abused by a sibling. Yet why isn't this paid nearly as much attention to? One of the reasons is because we have to take seriously that there is a normal amount of sexual exploration between children of certain developmental ages that we don't want to pathologize or inadvertently label as abuse. So we have to distinguish between sibling sexual behavior problems and actual abuse, which is another thing that I think is important to set out. Another thing that we've tried to do in our work is to set out a clearly defined definitional criteria. Because there's a lack of universally accepted criteria for what constitutes sibling sexual abuse, it makes collecting reliable data challenging. The extant literature as it exists is still plagued by a lot of definitional inconsistencies. So I'm going to offer you some ways to try and make distinctions, some meaningful ways to make distinctions between sibling sexual behavior problems and sexual abuse. One way to distinguish normal curiosity from child-on-child sexual abuse is the presence or absence of aggression, force, or coercion. However, it's not a foolproof method because we know that sometimes sexual abuse that appears consensual is actually based on fear. So we have to dig deeper before we can know for sure whether or not there's coercion or manipulation happening, or whether or not a child is just afraid to, or may not even be aware of the manipulation, depending on how young the child is. Another way that we've tried to distinguish between a sexual behavior problem and actual abuse is substantial age or developmental differences between the children. But again, I would caution you with this criteria as well, because while it's true that the closer in age children are, the more likely the sexual activity will be viewed as non-problematic, age differences also matter little in terms of harmful effects. We've had study after study now demonstrate that even with close age peers, sibling sexual abuse can still leave lasting harmful effects for the child who was harmed. And then finally, the third way that we often try to create meaningful distinctions between these two phenomena has to do with more advanced sexual behaviors. Obviously, if a child has learned how to engage in more advanced sexual behavior at a young age, we have to believe that that learning had to come from an older peer or an older adult for that matter. So oftentimes that can be a clue that there's abuse going on. If a child is actually learning to do sexual behavior that there's no way they would be able to learn from just mutual exploration with a developmental peer, that more advanced behavior needs to be explored as a possible consequence of sibling sexual abuse or sexual abuse coming from outside, perhaps. But studies comparing victims of brother sexual abuse and father-daughter incest conclude that the harmful consequences are equally serious. So here are the definitional criteria that we've developed to try and clearly define sibling sexual abuse. And this criteria has been refined also over a number of years now and is fairly widely been accepted. First of all, sexual acts between siblings that are initiated by one sibling without the other's consent. Remember, however, that consent can be tricky. Number one, because we can make a very good case that children are never capable of giving consent. Certainly that's true in terms of legal consent, but also remember, depending on the developmental age of the child, what might feel like consent might be actual manipulation or fear or some version, some combination of the two. But any sexual behavior between siblings other than exploratory sex play between developmental equals should be investigated. Now, what is exploratory behavior between developmental equals? It's usually transitory, and it's usually motivated by age-appropriate curiosity. So we know from childhood development that children between the ages of, say, 4 and 7 often experience an increase in sexual curiosity. We see children being more curious about themselves in terms of their sexuality, and if they have siblings, often being more curious about their siblings. So there's a range, there's a developmental range within which we can sort of think about this behavior in a normalized way. And many children may have had exploratory sex play experiences with developmental age-appropriate curiosity, and it doesn't necessarily harm anyone. But it's always important to investigate and assess the nature and the duration of the activity, the context, where and how did the activity occur, as well as other important protective and risk factors in the family. The other important criteria I want to make sure that we're all clear about here is that sibling sexual abuse may or may not involve physical touching coercion, or force. So there's common misperceptions that include this is harmless when it may actually not be, and that also include mutuality when it may not be. I've worked with many, many adult victims of sibling sexual abuse over the years. And I've worked with many who, when they sort of realize what happened to them might have been sexual abuse, are confused by the notion that they were actually enjoying it at times, and they might have even wanted it at times. But the key point that I always bring people back to, especially as adults, is how old were you when it happened, and how old was your brother or sister? And at that point, it's always simpler to determine who initiated. Once it was initiated, how it's maintained may seem mutual, but that doesn't mean that it was initiated in a mutual consensual way. So we need to understand that, but first, in order to understand that, we need to probe a little bit more deeply to be able to get that sense. So any sexual act between siblings that are initiated by one sibling without the other's consent, and it may or may not involve physical touching or contact. So sibling sexual abuse is not a disorder. There's nothing in DSM-5 that says sibling sexual abuse. It's not a diagnosis. It's a complex life experience. And because there's a wide array of sexual activities covered by the term sibling sexual abuse, it also guarantees that there's going to be a diversity of outcomes. The activities, the range of activities that might constitute sibling sexual abuse could be such as intercourse. In fact, it's been documented that there are higher rates of intercourse when there's sibling sexual abuse than parent-child sexual abuse. Why, you might ask? Because of the issue I brought up earlier. Greater access probably is one reason. It can include intercourse. It can include attempted intercourse. It can include oral genital contact, fondling of the genitals, either directly or through clothing, exhibitionism, exposing children to adult sexual activity or pornography, and the use of the child or the sibling for prostitution or pornography. I've had cases where a brother did not directly sexually abuse his sister, but he gave her out to other male friends to sexually abuse. So this wide range of behavior alone ensures that there's going to be a diversity of outcomes for the child who was harmed. In addition, the age and the gender of the child, the age and the gender of the offender, the nature of the relationship between the child and the offender, and the number, frequency, and duration of the abuse experiences all appear to influence outcomes. So I know that's a mouthful and it's a lot to unpack. We'll talk about some of this more in depth in a minute. But fundamentally, we can't make assumptions because sexually harmed siblings constitute a very heterogeneous group with many degrees of harm about which few generalizations can be made. We need to take seriously that each case, it can be unique, and the way in which the child or even the adult survivor experiences the harm can also be unique based on some of these factors I've just mentioned. So what do we know? We know that sibling sexual abuse generally begins earlier, usually before the age of 7, as compared to father-daughter incest or stranger molest. This is often the first sexual experience for sibling sexual abuse. That means that the child's first sexual experience may often be skewed by the impact of the abuse at the hands of a brother or sister. We also know that sibling sexual abuse disclosure is rare, much less common than child sexual abuse with a parent. The abuse usually ends when the sibling who harmed matures and leaves the home, when the offender is out of the home. That means that the sibling sexual abuse may go on for much longer than when it's a parent who's harming the child. We also know that siblings who sexually harm are more likely to have a history of childhood sexual abuse themselves, more likely to have a history of conduct problems, exposure to pornography, and domestic violence. But let's talk about pornography for a moment here. Exposure to pornography is problematic for both the children who harm the offender, but also for the victim. Exposure to pornography can be harmful to victims because we've got evidence that early exposure to pornography may impair a victim's ability to avoid and actually negotiate from dangerous situations, or what David Finkelhor has termed the protection process. In other words, exposure to pornography harms the offender because it might lead the offender to try and mimic or mirror some of the things that they're viewing in pornography and act them out with their younger brother or sister. But it also has harmful effects on the victim because it skews their perception of what's normal, and it skews their perception of what's dangerous. So it sort of interferes with that protection, that ability to distinguish between safety and danger that we know is so common amongst victims, where victims often get themselves in dangerous situations repeatedly and are confused about it and blame themselves and wonder, why is this that I keep being victimized in one way or another? Part of the explanation to that question has to do with exposure early on to things like pornography. I don't have a moral stance one way or the other about pornography. I'm not here to moralize about it. But I think it's important for us to think about when we know the data suggests that most boys by the age of 14 have been exposed to pornography. And for many male children, it's the way they learn about sexual contact. When you pair that with the reality that most pornography mixes sex and aggression, and most porn, I think about 88% of it, has women as victims, it's problematic in ways that we know and probably ways that we don't know. If that's the child's early introduction to sexual education, and in some cases, maybe their only introduction to sexual education, it potentially can be injurious. So these factors, including factors like developmental differences between the children, the child's victimization history, the use of coercion, very importantly, a lot of research has borne this out. One of the most traumatic impacts of sibling sexual abuse is not the sexual activity itself, it's the use of coercion. Coercion tends to lead to the most harmful effects. And that's another thing we often underestimate. We think about the sexual activity as being what's harmful, but it's actually the coercion that tends to have long-lasting harmful effects for children. These things all figure prominently in our treatment decisions. What do we know about sibling sexual abuse offenders? Well, we know that they frequently live in vulnerable families that may not come to the attention of child protective agencies. In other words, they are often not detected, and yet they're living in families that are vulnerable, i.e. more risk factors and not enough protective factors to be able to actually keep the violence from happening. So they frequently live in vulnerable families, but families that may not come to the attention of child protection. They often exhibit sexual behavior problems prior to adolescence that are not addressed. This is partly why the sexual behavior is allowed to continue. Sibling sexual offenders are significantly more likely than those who sexually harm non-siblings to exhibit developmentally inappropriate sexual behaviors before the age of 10. In other words, we've got pretty good evidence now that once the sexual abuse behavior is disclosed, we find out that oftentimes the sexual offender was actually giving off clues, if you will, of the problem, but for whatever reason, the family system wasn't paying attention. There might have been developmentally inappropriate sexual behaviors like inappropriate touching of others, which was passed off as just harmless, or inappropriate public self-stimulation. I've had cases where children are found masturbating in class. The teacher might even report it, and the child still might not be some intervention that happens. There are a number of other studies that suggest that ACEs, adverse childhood experiences, which I'm sure many of you are familiar with, are more often found to occur in the lives of sibling sexual abuse offenders. A recent study revealed that a significantly greater mean number of adverse experiences in childhood occur for sibling sexual abuse offenders. Things like caregiver abuse, for example, is one of the adverse experiences, and very importantly, neglect. So what percentage of siblings who sexually harm are also victims? A very important question. If we assume that there is often some role of a sexual victimization history with a sibling offender, what percentage of those siblings who sexually harm are also victims? Here's what we know. In terms of the maltreatment history, the estimates range from about 35 to 45%. So about 40% of sibling sexual abuse offenders have also been sexually abused themselves. But that still leaves us with a conundrum. What about that other 60%? Here's the thing. We know that for a lot of sibling sexual offenders, it's not necessarily that they were sexually abused, but there are much higher estimates of physical and psychological maltreatment in the histories of these folks who sexually harm. Something like 60 to 90% may have experienced physical or sexual or emotional harm. I'm sorry, not sexual harm, but physical or psychological maltreatment rather than sexual abuse, which again allows them to somehow fly under the radar when it comes to the sexual abuse being acted out. So we need to take more seriously that we don't really understand enough about how that, say, emotional maltreatment gets converted into sexually harming another sibling in the family. But we've gotten enough data now to know that it's only about 40% of the sexual abuse offenders who are actually sexually victimized themselves. And we also know something about females in particular who sexually harm. Even though this is a smaller proportion, male victims are guilty of more sexual harm against a sibling than females. There are female sibling sexual abusers, to be sure. The females who are more likely to be victims of abuse and neglect, and they're more likely to have witnessed sexual deviance. Again, exposure to pornography or exposure to other kinds of sexual deviance in general. Also, females who sexually harm, who are siblings, also more frequently among the younger youth who commit sexual offenses. So we'll begin earlier if it's a girl, if it's a sister sexually harming another sister or another brother. In fact, the history of prior victimization for a girl is often associated with an earlier onset of the sexual harmful behavior before age of 12. Very important in the context of all of this information, which I know I'm throwing out a lot of information and a lot of data here. It's very important to think about this in the context of reoffending rates. We have a number of studies now that suggest that a lot of childhood sibling sexual offending does not significantly predispose one to engage in adult sex offending. Children who sexually harm, who receive adequate intervention, have relatively low reoffending rates, something between 2 and 15%. Now, I'm not suggesting that that's still not an important reason for us to take notice, because even one reoffending rate is something we should address. So it's not about minimizing, but the absence of continuity in sexual offending over the life course, especially for children who sexually harm another sibling, calls into question our US sex offender registration policy and notification policy as it applies to successfully treated children who sexually harm. What we need to accept, and what often doesn't get widely disseminated, is that the research conclusively demonstrates that children represent a population distinct from adults who commit sexual offenses. We should not be labeling most of these children as mini adult sex offenders. There are distinct developmental differences between children who sexually harm and adults who sexually harm. And we have to take seriously that our interventions should be directed concurrently. But this is information that oftentimes gets lost in the kind of panic. And certainly I can understand why parents and even professionals would be alarmed when they determine a case of sibling sexual abuse. I'm not suggesting anything different. I'm just suggesting that we have pretty good data that if intervention happens, in fact, I'm trying to make the case for earlier and more effective intervention so that we can ensure that reoccurrence doesn't occur. And we have data to suggest that if adequate intervention occurs, the reoffending rates are relatively low among sibling sexual offenders. Who are the children we need to be worried about where reoffending might occur? That's a question worth asking, I think, and that's the reason for this slide. For one thing, if a child has sibling as well as stranger victims, that's more problematic. If much younger child was sexually abused rather than a peer victim, that's a risk factor. If there were threats or weapons used, that's a risk factor. If there were prior sexual offenses in that sibling offender's history, that's a risk factor. If the sibling offender chose only male victims, that's a risk factor. Older age at disclosure is a risk factor because by the time the disclosure happens, if it's at 13, we may not know anything about the history prior to 13 other than the current offense. So that potentially could be a risk factor. And if there are prior non-sexual offenses in that offender's history, that could also be a risk factor. So in terms of evaluation, assessment, parental support is crucial in promoting better outcomes. But parental support in terms of sibling abuse is complicated, and it's a multidimensional construct. It means relieving the child, it means providing emotional support for the child, and it means taking protective action, contacting professionals, or restricting contact between the offender and the child. Circumstances of sibling abuse complicate parental's provision of support. Why? Because when it's one of your children who's harmed another, what we have often are called divided loyalties. They're much more likely to occur when the child who is harmed and the victim are siblings. In addition to that, just unbelievably difficult conundrum for parents to have to face of one, not wanting to turn in one of their children, and two, not understanding quite the seriousness of this at first, or maybe understanding the details of what happened. Parents are also significantly more likely to report higher blame and doubt when their child was reported to have been sexually abused by an adolescent versus an adult. In other words, these misperceptions about children not being able to really harm other children are widespread in many clinical families. We even have evidence to suggest that parents of minority children may have significantly higher levels of blame and doubt about their child's sexual abuse when the offender is also a child. And I'd be glad to offer some hypotheses about why that might be so during the Q&A if people are interested. But it underscores the importance of a culturally sensitive assessment and intervention process. It's important not to dismiss sibling sexual abuse as harmless exploration, but it's equally important not to pathologize developmentally normal sexual behavior between siblings. So in the context of this, I mentioned earlier that we developed the Sibling Abuse Interview, the SAI, which you'll have a handout available to you. And this is nothing more than a psychosocial assessment that's designed to help you enhance your evaluation and clinical intervention with families. It includes a thorough evaluation of risk and protective factors. You can explore the history and the status of the current sibling relationship through a series of questions related to each family member. There's a whole family piece, there's a sibling dyad piece, and there's an individual piece. And it focuses most heavily on current contextual factors. In other words, what's going inside the family, what's going on inside the family, what's going outside the family. Things like disciplinary practices, unclear boundaries in the family, sleeping arrangements, favoritism, that sort of thing. The effects of the traumatic stress on the individual subsystem and family functioning are all addressed. And sibling strengths are also highlighted because we need to evaluate safety concerns and sources of resilience in the family. You don't need to complete the whole interview with a family to get benefit from it. You can easily take one part of the interview and just use it and help it guide your clinical or professional protective intervention. Some protective factors, just to highlight, that we would want to look for have to do with disclosure. Very importantly, how did disclosure occur? And what was the caregiver's response? These are some of the most important questions to ask in the beginning when disclosure happens. How did disclosure occur, and what was the caregiver response? Because the parent's protective capacity is very important in relation to setting good boundaries. If parents demonstrate an ability and willingness to protect their child or children, that's a very important protective sign. The presence of even one significant attachment figure for their child who was harmed is also a very important systemic protective sign. And the presence and availability of any community support systems, neighbors, teachers, friends, spiritual communities can all be thought of as important protective factors. Risk factors. multi-problem families, which result in limited parent availability or supervision. Parents who are unable or unwilling to adequately supervise their children obviously is a problem that has to be faced head on. Attachment difficulties. And remember, it's not only about the parents being around, but it's also about how connected are the parents to the children. What's the attachment relationship like between the parent and the child who harmed, or the parent and the child who was harmed? So there may be oftentimes attachment difficulties where parents are physically available, but emotionally absent from the family. I've worked with many seemingly high functioning looking families where sibling sexual abuse and sibling violence are still allowed to happen because the parents were not adequately emotionally available for their children. If there's other kinds of maltreatment in the home, that's obviously a risk factor. And if the parents have a policy, or whether it's conscious or not, of parental favoritism, of favoring one child over another in the extreme, or differential treatment of siblings in the home, those can be risk factors. Any sort of sibling relationship where there's power imbalances, gender role rigidity, unclear boundaries in the family, all of these can be systemic risk factors. And a heightened sexual or sexually repressed family environment can also constitute a risk factor for some people. In terms of cultural considerations, I can't emphasize enough how important it is to understand the family's cultural context. We need to take seriously what the strengths and supports are available for the family based on their cultural niche within the wider societal niche that they live. And also, we need to understand whether the family's cultural context creates any barriers to disclosure and engagement with services. If there are barriers, how can we address those barriers in a culturally sensitive way? We have to understand the cultural context in which the family conceptualizes itself in order to be able to intervene with the family. That means we may need to take some time letting the family explain that to us. Explain the roles in the family, the norms in the family, the beliefs and the boundaries from the perspective of each family member in order to build a clear, detailed, and sensitive picture of the cultural niche in which the family operates. This is especially important with regard to the intersection of power and gender dynamics, which often intersect with cultural dynamics in the family. If it's appropriate, there's an emerging consensus in the literature that professional involvement should include the needs of the entire family whenever possible, from the moment of disclosure to the discovery of the abuse through intervention. A range of professionals can sometimes be appropriate from different disciplines. It's much, much better to work with teams around this problem than as an individual. You need to be working either with a child advocacy center, if there's such a center close by where you're working, or another community center that might be helpful in being able to provide a range of services. Medical forensic evaluation and intervention is sometimes important. Community resources, almost always important. Any family members as defined by the family who might provide an alternate supervision or sources of support. The complexity of sibling sexual abuse calls for unique intervention schools, including working with survivor narratives that do not always fit the standard victim-offender dichotomy. In other words, many times children will not experience themselves as being victims at first, but that doesn't mean that there wasn't harm. So we have to take seriously that one size does not fit all. And also that unlike parent-child abuse, many times offenders who are siblings remain in the home after disclosure, which means family meetings may need to be delayed until the offender has accepted responsibility and the family can protect the child. Supporting child safety is number one. Exploring the parent's ability to protect, even if they're not convinced the sibling abuse occurred, is important. Paying attention to the function of denial in terms of the sibling who harmed and the child who was harmed, very important. And to find a frame, whatever you can, to coincide with the family's concerns so that you can assist in whatever way the family will allow you to subsist. I'm mindful of the time, so I'm going to try and wrap this up as quickly as possible so we can have some time for questions. So frequently we want to monitor and address the caregiver's capacity to effectively supervise and monitor siblings' behavior and address any barriers to monitoring their behavior, obviously. Next slide. Pay attention to coalitions. In sibling abuse cases, there's often a family team and a victim team. They're often, because you're dividing the family between two children in the same family, it's very important to pay attention to that schism and see if you can hold everyone in the same strong container, so to speak, because everybody's going to have to address this problem with the family as a whole, if possible. Next slide. Secrecy, very important challenge, because in many cases, secrecy is going to make it difficult to engage and intervene. Remember, there's pervasive underreporting, partly due in part to parents' misperception about sibling sexual abuse as being normal, partly due to the fear of child welfare involvement, partly due to the stigmatization that goes along with this. But there are multiple levels of complexity that need to be addressed in these cases. And just one more thing before we wrap up here, we did some research around adult sibling sexual abuse survivors. I just want to point out to you that are important pieces of data, I think. One is that we looked at what's called sibling estrangement, what we termed emotional cutoff, the relationship that adult survivor siblings have with their offending brother and sister, and the rates are skyrocketed. There's the psychology in general assumes that there are less than 6% of siblings who ever permanently cut off from a brother and sister in their lifetime. 39% of our participants endorsed an emotional cutoff pattern with a sibling. So the sibling relationship remains fractured into adulthood, which has big consequences for people growing up. The second thing has to do with marriage rates. The non-marriage rate of adult survivors who were sexually abused by a sibling in childhood are also off the charts. The US Census suggests that about 75% of us over the age of 25 will eventually marry at least once. But in our data set and other data sets that have been since reported, about half of sibling sexual abuse survivors never marry. So that's a pretty serious harmful effect. So more needs to be done, obviously, both for us as professionals, but also for society. We want to continue to think about and work with sibling assessment measures. And we want to also make sure that as a society, we take seriously that this is an issue that we need to address as a society as a whole. We need to try and establish as much as we can no hitting policies in families, because physical aggression is being modeled. Siblings are going to pick up on it. And we also have to do more to just make sure that we understand that in the sibling relationship, even though it may be a peer who committed the harm, it can still be injurious. I'll stop there.
Thank you so much, John. This was an incredibly informative webinar. I feel like we've gotten a bunch of questions in. I feel like we will not have time to do all of them, but I feel like maybe, yeah, Jennifer is saying more, so maybe there's, room for a part 2 or, but I wanted to take, our last, 8 or 9 minutes just to share some of the questions. We got some questions in about the relationship between either suicidality or like siblicide, and sort of what are there any statistics on whether there's homicide that occurs between siblings, and then also rates of suicide amongst those who are harmed.
The rates of suicide among those who are harmed are significant. I tried to allude to it briefly in the slide earlier about the study that was done nationally on about 3,000, 4,000 children. Unfortunately, I've had enough clinical experience over the years to notice that the suicide issue can happen in many ways. It can be delayed. Children may grow up and still, because of what we talked about in terms of trauma, be harmed by not having a close relationship with the family because of the abuse that happened in childhood. And that can result in a survivor feeling tremendously lonely and isolated. And I've had instances of patients committing suicide 20, 30 years after the event because of the lack of validation from the family that this was important or that this happened, or the lack of reining in the other brother or sister who were doing the harm. So I don't have data on the statistics about how often suicide occurs, but it's a real event. Siblicide is a whole different story. It's a relatively rare phenomenon. We know And most of my research has not been involved in it directly, so I don't want to quote something that I don't really have a good grasp on about how the rates, look.
Appreciate that. Yeah. So we had some questions on cultural differences in terms of sibling sexual abuse in particular, but also on the family's reaction to sibling sexual abuse.
Good question. There are cultural differences. We're just beginning to collect data on this, so I want to suggest that this is preliminary, and it may change over time. But actually, white families have higher rates of both sibling violence and sibling sexual abuse than cultural minority families in this country.
Interesting.
It's very interesting, yeah, to think about in the context of, also why it's underreported, because I don't think it comes to the attention of protective services because many families chose not to disclose it.
Mm-hmm. And that was another question we had about sort of how to support those sort of parents that are struggling with either the divided loyalties or feelings of guilt once they do go and seek out, whether it's law enforcement or professional help or child welfare. So supporting parents through managing, again, like different loyalties, but also feelings of sort of ambivalence about whether I even should report.
Yeah, well, it's one of the real important therapeutic challenges in these kinds of cases, one that warrants more time than we have now to go into. But yeah. I will say it does underscore the point that you need, if you've got a case like this, it's very important to see the parents separately and to see if you can determine what that level of divided loyalty is in that family. How much of this family divided already into teams, one aligned with the offender, one aligned with the victim, and do as much as you can to support the parents holding both children at the same time, because both children are going to need intervention. And the tendency to villainize one over the other is high. So our job is to try and create an environment where this is a family problem and that requires a family response. We cannot address only the child who harmed or only the child who was harmed without really effectively intervening. And that's just a given.
That systems perspective that I feel like kept driving home is that this really is a family system and also is part of a larger system. And really taking that systems approach is going to be key, I think.
It's very important, and we have evidence to support this. It's not just my orientation or my theoretical bias. We've had clinical cases where families were treated, and the family cases always do better because the family cases mean that everybody's going to be invested in the solution.
Yeah, and it goes back to what you're saying about not treating, the young person who harms as like a mini adult sex offender. Rather, this is a systemic issue.
Right. I have a client just the other day who said to me, this is an adult survivor who was a victim of two of her brothers who sexually abused her over the course of her childhood. And she said this, not with any prompting by me at all. She said, they're not monsters, but what they did was monstrous.
Yeah. Oof, that really, I feel like that is such a note to end on. I feel like that is a really powerful statement. I think one that's going to sit with a lot of us. Thank you so much, John. This was incredibly informative. I feel like, I don't know, I learned a lot. I feel like other folks, it seems like from the chat are really, learned a lot, and also maybe you're invested in a part 2. So we'll see if that's a possibility. Thank you everyone so much for your questions and comments. As I said before, a feedback survey is going to pop up as you close out of the webinar. If you are looking for CEs, you'll get an email about that in a couple days. I also want to promote on August 4th, which is coming up sooner than we think. I don't know how it's August already. We are having a webinar on narrative therapy with families. It's from 12:30 to 1:30 on August 4th. And you can find more information on that and on all of our events on our website, ctacny.org. So please check that out. And thank you all. Thank you, Dr. Cafaro. I feel like this was an incredible offering, and I hope everyone has a great rest of your day.
Thank you very much. I really appreciate the questions and the attention of the audience, and I'm pleased by the response. Thank you very much.
Thanks everyone so much.